Thanks everybody for joining us today to our live Q&A between the World Health Organization, young people around the world, and FP 2020. Before getting started, I want to review some quick logistical information for today's webinar. I'll be speaking in English and mon collègue Yassine va faire une traduction en quelques minutes en français. First, in addition to today's presentation, you should see a Q&A pod where you can submit questions. And please feel free to add any questions in English or French. If you experience any technical difficulties, please use the chat box where you can send chats to all attendees or to the meeting hosts. In the event that you're unable to reach us or need to use email, please email Yassine, and her email address is ybai@familyplanning2020.org. We'll also be posting live on our Twitter and Instagram. Please follow us on @FP2020 Global for Twitter and @FamilyPlanning2020 for Instagram. Today's webinar and slides will be in English, but we will have a simultaneous interpretation in French. Before we start the webinar, everyone needs to select a language option. Please look at the bottom of your screen and locate the globe icon that says interpretation and select your preferred language, English or French. If you are choosing French, you can click on mute original audio if you don't want to hear the English translation. If you are on an Android or an Apple mobile device, in your meeting controls, tap the 3 dots, then tap language interpretation, then tap English or French. If you select French, please toggle the mute original audio if you don't want to hear the English narration in the background. And finally, this webinar is being recorded. Thank you again for joining us, and we look forward to your participation. And now Yassine will give us a short translation. Yassine?
Le webinaire sera en anglais, mais il y aura
the webinars today will be
une
in English,
interprétation en français.
but
Avant
there
de
will be
commencer le
simultaneous
webinaire, chacun doit choisir
interpretation
une
into
option
French.
ici. Regardez
Before
en
we
bas de
start the
votre
webinar,
écran
everyone
Zoom
needs
et
to select the
trouvez
language
l'icône de
option.
globe
Please look at the
terrestre
bottom of
qui
your Zoom
indique
screen and locate the globe
interprétation.
icon that says
Sélectionnez
interpretation.
votre langue
Please
préférée,
select your preferred
l'anglais ou le
language, English
français.
or French.
Si vous choisissez le
If you're
français,
choosing
vous
French, you can
pouvez
click
couper
on
le
mute
son
original
original
audio
si vous
if
ne
you
voulez
don't want
pas
to hear the
entendre la
English
narration
narration
en
in the
anglais.
background.
Si vous êtes
If
sur
you are
un
on an
appareil
Android
Android
or Apple
ou
mobile
Apple,
device,
appuyez sur
in your
les
meeting
3 points,
controls, tap the 3
ensuite
dots,
appuyez
then
sur
tap language
l'intégration
interpretation.
linguistique pour anglais ou français.
Tap
Si
English
vous
or
avez
French.
des
If you
questions à
select
ce
French,
sujet,
please toggle
n'hésitez pas
mute
à les poser
original
des
audio
questions dans
if
la
you
boîte
don't want to hear the
discussion.
English narration in the
Merci.
background. Thank you.
Merci, Yassine. Okay, so today we have a really dynamic group of speakers. And I really would like to just take a moment to give you a sense of who will be speaking today. And of course, this is a dialogue. This is not a panel. So we're anticipating a very dynamic conversation between young people as well as our speakers. So our first speaker, our first person on our list is Beth Schlachter, who is the Executive Director of FP 2020. Many of you know her. Victoria Watson, who's the Executive Director of the International Youth Alliance for Family Planning, is joining us today. Mansa Priya, I'm going to mangle your name, Mansa, Vasudevan? I'm so sorry. Mansa is a program manager for the YP Foundation in India. She's also on our FP 2020 reference group. Natasha Kauma, Dr. Natasha Kauma is the Executive Director of Copper Rose Zambia, and she's also a member of the FP 2020 reference group. From WHO, we have Dr. Ian Askew, who's the Director of the Department of Sexual and Reproductive Health, WHO HARP FP 2020 reference group. We also have Dr. James Chiari, who is the Unit Head of the Contraception and Fertility Care Department at WHO. Dr. Avni Amin is the Technical Officer on Violence Against Women at WHO. And finally, we have Dr. Chandramuli, who is a scientist, who is our colleague on adolescent sexual reproductive health and rights, and he's also at the Department of Sexual and Reproductive Health at WHO. So now I'd like to ask Beth to give us a couple of welcoming remarks. Beth will be followed by Victoria and then Ian. So Beth, over to you.
Thank you, Kate, and good morning, good afternoon, or good evening to all of you, and thank you very much for joining us. We hope that we find you and your families and the people you love and care for all safe and well during this very troubling global moment of a pandemic. At FP 2020, we feel very strongly that we want to use our platform through the partnership to keep our community connected and informed. And we're very grateful to IY and to WHO for partnering with us this morning to put all of you together with trusted technical experts and colleagues from the World Health Organization so that you can speak directly to them, ask them your questions, and through your questions, then give them the information they can use to help shape programs, the policies, and the guidelines that WHO will be producing. I know I speak for many when I say how grateful I am to WHO for the incredible work you do every day, but particularly during this pandemic. You are our trusted colleagues that are going to guide us through this pandemic and into the time in the future. I know that many young people here on the line with all of us today have the same concerns we all do about what the world will look like, what our opportunities will be, and how we'll stay safe and healthy through this time. So thank you for being with us to help us all feel a little bit more in control of our personal lives and the relationships that we care about most dearly. So with that, Kate, I'll turn it back to you and just say thank you all for joining us today.
Thanks, Beth. I'd like to hand it over to Victoria now for her remarks.
Great. Thank you so much, Kate. Hi, everyone. It's so lovely to be virtually meeting you all today. And it's my pleasure on behalf of the International Youth Alliance for Family Planning to welcome you here with us today. And thank you for joining us for this live Q&A about COVID-19 and its specific impacts on the sexual and reproductive health and rights of adolescents and youth. Just like Beth said, first I want to thank FP 2020 for leading this initiative and bringing so many great leaders and voices together and working so diligently to gather young people's priorities, stories, and questions, and really giving us that space to provide evidence-based, community-centered answers to their pressing concerns. We at IYAFP, the International Youth Alliance for Family Planning, are just so excited to be co-hosting this panel and Q&A alongside WHO, FP 2020, and in conversation with the YP Foundation and Copper Rose, Zambia. This is going to be such an amazing, energizing dialogue and conversation. We are also just so honored to be with everyone. I think we've got over 228 people here with us today on this call. And despite how busy we are, everyone is here. And I think what this does is it really serves as a reminder of how critical this matter is in light of the pandemic and our efforts to curtail long-term impacts on young people's health, their freedoms, and quality of life during the pandemic, especially their sexual and reproductive health. This year, the COVID-19 pandemic made our mission at IYAFP to advance young people's access to sexual and reproductive health and their autonomy an even greater priority. In the event of a global pandemic emergency, as this virus has shown, young people and adolescents' experiences is the highest degree of marginalization, and that's what they face, especially for those living with disabilities, young people who are refugees or migrants, or young people who are facing pre-existing forms of discrimination. For us, it's clear that COVID-19 brings unprecedented threats to our already fragmented access to sexual and reproductive health and health equity. For us as young leaders, it's our goal to make sure that young people's SRHR does not get sidelined by competing pandemic priorities, and to ensure that young people do not get further disenfranchised by this pandemic. So to that point, we're really honored to be joining Beth Schlachter from FP 2020 and Ian Askew from WHO today, who we believe are not only two of the topmost scientific leaders, but also longstanding advocates for youth-centered global health action. So just thank you all for having us with you and for facilitating this really exciting dialogue today.
Thanks, Victoria. It's great to have you with us today. I know you represent a large constituency of young people around the world. I'd like to now ask you from WHO to give a couple of opening remarks. Ian?
Thank you, Kate, and thank you to Beth and Victoria for the warm welcomes. And on behalf of my colleagues at WHO on the call as well, we're very, very happy and honoured as well to be part of this event today. We've all experienced the impact of the COVID-19 pandemic in one way or another individually. I mean, the fact that we're having the meeting this way is just one small reminder that this pandemic is affecting us in multiple ways. And in terms of sexual and reproductive health, it's an important aspect of people's lives generally. And certainly in this situation, there's a lot of concerns and a lot of worries about the impact it's having individually and across communities generally. We're here to try to both listen to and answer your questions and queries, but also we have a few questions of our own that we'd like to ask and get your feedback, because this has to be an interactive process. We can only carry out our function if we're well informed with what people need to know from us and how we can best put together the evidence and the guidance that is WHO's role globally in trying to address the pandemic. So we're looking forward to engaging in this and to both being able to hopefully provide some new information if needed, but also to refer you to existing information. But most importantly, to hear what are your concerns, because as WHO, we're able to work with ministries of health, with other service delivery organizations, with other advocacy groups around the world. And so it's important that we're well informed ourselves as to what are the concerns, and that we're guided by your concerns in the way that we move forward on this. So thank you again for the welcome, and we're looking forward very much to being part of this exciting morning and afternoon, sorry, and evening for some people. So,
Thank you, Ian. Thanks. It's great to have WHO here. Obviously, WHO, many eyes are turning to WHO to lead us through this very uncertain time. And so I think it's just fantastic to have you here with us this morning, this afternoon, this evening, to really speak one-on-one with young people. And we know young people have a tremendous amount of concern about the impact of the virus on their lives in general. So we're going to take a few minutes now to just kind of bust some of the myths, just cover some of the frequently asked questions, and just sort of set a baseline for the conversation this morning. So we're going to go back to WHO for a few minutes to have each of our panelists from WHO discuss a little bit about what WHO's role is in addressing the pandemic. So I'm going to go back to Ian first, and then James, and then Avni, and then Chandra. So back to you, Ian, to tell us a little bit about how WHO is addressing COVID.
Okay, well, thank you. WHO is, as you can imagine, heavily involved in many aspects. Our overall role is to try to provide global leadership and guidance across the whole gamut of issues arising around the health response particularly, but we're also very engaged in looking at the interactions between the health response and health effects, and the social and economic challenges that that individuals and communities and countries are facing. In terms of the issues around what is COVID-19, how is it transmitted, how do I protect myself, there are a lot of myths around. Inevitably, when something like this happens quickly and affects a lot of people, information is often quite sparse at the beginning. We've been now in our 5th month, I guess, of this being a public health epidemic, a pandemic now. And so many of the myths are now being addressed. We now have a much better evidence base to understand how transmission occurs, what are the best ways of prevention, and what are the best ways in terms of treatment and survival if people are infected by the virus. I won't go through all of these, but I would refer you to the WHO website, where there is a whole section on myth busting, and I'd refer people to that, where basically we've compiled a long list of the many myths that have been emerging over the past few months, and trying to provide the evidence as to why, in fact, these are myths and are incorrect. We also have on our website the key information needed around how is it transmitted, and what are the best ways of preventing, both in terms of receiving and being infected, but also preventing infected people from passing on the virus to others. And I'm sure in many people's countries individually, there's a lot of information being communicated. We do hope that in these cases they are drawing from WHO's guidance. I mean, our role is primarily as a scientific agency to bring together the evidence. And so we have a huge team of people throughout the organization on a daily basis, compiling the evidence that's coming through. The massive amount of literature available that's being generated now by researchers is being reviewed on a daily basis. And so our evidence base is as up to date as it's possible to be. So I would encourage people, if you are looking for a credible source of information, please consider coming to the WHO website as the starting point. In terms of the specific issues around the interaction of COVID-19, the pandemic, and the health system's disruptions and the social disruptions that have occurred because of this, I'll hand over to my colleagues, James, Avni, and Chandra, to talk more specifically about some of those, to set the scene for the rest of the discussions and the interactions that are going to come. So thank you. Back to you, Kate.
Thanks, Ian. And just so people know, we will be sending out some links after this Q&A. We will send an email out to participants that have a lot of the links and to the resources that Ian is discussing. So now I'd like to ask James Chiari, who is going to talk to us a little bit about COVID-19 and its effect on contraception and sexual and reproductive health. So over to you, James.
Okay, thank you very much, Kate, and also to FP 2020 for this invitation. As we all of us know, there are very many myths and a lot of misinformation around contraception that circulates even outside the COVID situation. Many of these have been kind of exacerbated by the situation that we find ourselves in. I'll try specifically to address important facts in the context of COVID, but just to kind of remind for us who work on contraception that all methods of contraception are safe to use by young people. There are no age restrictions that are related to any method of contraception. However, in the context of COVID, I would like to highlight 5 key facts. One is that continuation and initiation of contraception is a critical and essential service. And this is important at all phases of the pandemic, whether it is before lockdown, during lockdown, or even as a lockdown is lifted. Therefore, it is important to explore what has been put in place to ensure access. Many countries have put in place dedicated phone lines, online support, availability of contraception through other platforms like pharmacies, and also specific community-based services. And it's important to explore how one can access contraception during this period. And thirdly, there are many methods that are available without prescription. And I would just like to mention a few, although these may vary by country contexts. These include condoms, fertility awareness-based methods, some of the diaphragms, spermicides, the lactation or amenorrhea method for women who have just delivered within the last 6 months, and emergency contraceptives, and also oral contraceptive pills. And therefore, this can be obtained without prescription in many of the countries. And if one is having challenges accessing the healthcare system, then these would be available alternatives. And fourth, there are no health concerns that have been reported regarding any of the contraception methods and COVID. So during this pandemic, there have been no concerns reported regarding use of any method. And in WHO, we continue to monitor any emerging evidence. And what we have is what we call SIA, which is continuous review and identification of evidence. So we are every day reviewing any emerging evidence regarding any concerns between contraception and COVID. And I would like to assure everyone that so far we have not observed any concerns. And lastly, as countries come out of lockdown, a big challenge is the concern regarding COVID infection. This is making plans not to seek services even when these are available. And as WHO, we are working with countries to ensure that this risk is minimized. So through the use of PPE and reorganization of facilities, it will be possible for you to access your choice of contraceptive methods as lockdown is lifted. And thank you very much again for the invitation, and over back to you, Kate.
Thanks, James. And that's really good news to hear that there's no contraindications between COVID and contraception. Now I'd like to turn it over to Avni Amin, who's a gender-based violence specialist at WHO. And one of the things we sometimes hear is when there are pandemics of this nature and when there's lockdown, that young women or even young men could be victims of gender-based violence. So Avni, I'd like to hear what your perspectives as well.
Thank you, Kate, and thank you, colleagues from FP 2020 for this invitation. I'm going to briefly address a few things in terms of what we need to think about with respect to gender-based violence and violence against adolescents more broadly in the context of COVID. A lot of people have labeled this in some respects the shadow epidemic or shadow pandemic. And for adolescents, I think there are three forms of violence that are likely to increase under these circumstances. So first is obviously gender-based violence, intimate partner or domestic violence. The second is online violence, as more adolescents and people are online and subject to online harassment, bullying, and sexual exploitation. And the third is child maltreatment, which is parent-to-child physical, emotional abuse and neglect. And the risks under the COVID pandemic, and we've seen this also in the aftermath of Zika, but the specific risks under outbreaks in this particular epidemic is really first is basically under lockdown, there's increased time spent at home, locked up with perpetrators of abuse. The second is that as economic uncertainties are increasing, there's homeschooling, children are at home, there's an increased burden of caregiving, there's increased stress in the household, there's increased conflict, and particularly this bears out in contexts where there's crowded living conditions. Then there is for adolescents the specific issues around boredom and sex. At home, where they have nothing else to do, and they continue to have sex, and the risk of coercion and violence, sexual violence, is there. The next thing to think about is lack of protective social networks. So disruption of family networks, peers, interaction with family members, relatives, friends, neighbors, etc. And also disruption of services. So hotlines, so other social services, child protection services. And then the last thing to think about is the increased use of alcohol and other substance use as another risk factor. We also need to think a little bit about who is most vulnerable. So it is, I think adolescent girls were mentioned, but of course boys are there as well. But I think girls in particular are at high risk for certain forms of violence, such as sexual abuse. Contexts where there is, people living in crowded conditions, social and physical distancing in many ways you realize is a luxury and privilege for a lot of people. So to think about that. Humanitarian contexts. And then just to maybe, before I sort of talk about specific recommendations to address this issue under the pandemic conditions, maybe just point out 3 sets of resources, which hopefully you can send the links to. One is a guidance note on violence against women. And then we are also following that up with family violence guidance, which will include children, adolescents, and women and older people. And this is largely for an audience of what we call duty bearers. So governments, policymakers, health managers, service providers. Then the next is a set of Q&A, and the Q&A have a specific dedicated Q&A on violence against women. But there is also reference to how to address issues of online violence and violence that adolescents face in the adolescent Q&A. There is a reference to how to address issues of child maltreatment in parenting Q&A, as well as in the mental health Q&A, which refers to violence and stress. And then lastly, there's a set of infographics, which are largely for a general public, outward facing, including survivors, including what we call bystanders. And those infographics, again, cover violence against women and safety planning in that context, stress management and violence, as well as alcohol and violence and parenting tips. So how do you actually parent in non-violent ways under these very stressful conditions? So I'll stop here for now, and then maybe in the Q&A I can point out some specific things to think about.
Thank you, Avni. And then our last myth buster is Dr. Chandramouli. Many of you know Dr. Chandramouli. He's a very ardent advocate for adolescent sexual and reproductive health. And Chandra will just give us a few remarks regarding the effect of COVID-19 on the sexual and reproductive health of adolescents and young people. Thanks, Chandra.
Thanks, Kate, and greetings all. I'd like to make 5 points to set the stage for a discussion on a particular focus on adolescence and contraception. And the first is a point that Dr. Tedros made in one of his press briefings, and that children and adolescents are at low risk of serious forms of COVID-19, but are not invincible. It is important, therefore, for children and adolescents to follow advice on hand and respiratory hygiene and physical distancing, just like adults. And by beyond protecting themselves, they can also play an important part of the overall solution, as they are in protecting others from serious forms of the disease. So that's point number 1. Point number 2 is when we talk about adolescents, as Avni just mentioned, we're talking about a very diverse group. For some of them, a lockdown may be a welcome time to be at home with the family, to study at home with substantial remote support from the school. For some others, it might not be a time of distress, but it may be a time of discomfort. They have everything they need, but they feel a little uncomfortable about being too close at home and with their parents. But for some other adolescents, this is a time of crisis. Family members may be sick or dead. There may be no money to buy food or to pay rent. There may be tensions, as Avni mentioned, between family members. There may be addiction problems among the adults. And so all these are important issues. So it's a very diverse group. And so it's important constantly in the next hour to acknowledge and address this diversity. The third point is that adolescence is a time when individuals are developing their independence, their interdependence, their relationship with friends, their world outside the home. And for many adolescents, it's frustrating. It's a time of frustration to be kind of hemmed in. And it's normal to feel frustrated, to feel angry. And so this is perfectly something that we need to acknowledge. The fourth point is that COVID or no COVID, adolescents are sexual beings. Growth and development occurs and has occurred around the world over the last 8 weeks or 12 weeks. Girls menstruate or start to menstruate. Boys have nocturnal emission. sexual thoughts and feelings arise even if you're sitting 6 feet away from your parents. Sexual needs are present and sexual activity is occurring, sometimes consensual and sometimes coerced. And we shouldn't also present all sexual activity as coerced or forced. A lot of sexual activity is actually consensual, maybe occurring with a home guest or a neighbor, and that's also something that we need to bear in mind. And lastly, my last point is, even in the time of normalcy, the sexuality of adolescents is not acknowledged, it's not addressed. Access to sexuality education is a big problem in many parts of the world. Contraceptive information and services is a problem for unmarried adolescents because they are not supposed to have sex, and for married adolescents because they're supposed to have children. And so it's a big problem. Access to STI services is a big problem. And this clearly has been heightened in the time of COVID. But that should not be the end point of the discussion. That should be the starting point of the discussion. And I'd like to echo what James said. Things are actually happening. And the last point I want to make is a report I heard yesterday from Love Matters India. Love Matters India is a website which provides, edutainment, information on sexuality and sexual and reproductive health in a friendly and accessible way. And they're starting an initiative to inform people about where they can get contraceptive information and services where they live. So there are initiatives underway. And so I hope in the next hour, we can talk about problems, but we can also talk about solutions. Over to you, Kate.
Thanks. And it's clear that in this, as we're sort of navigating our way through this pandemic, that we need to continue to highlight the importance of ensuring young people have access to the support that they need to make healthy choices and decisions. And I think we need to continue to advocate and ensure that our governments are indeed responding to the needs of young people. Okay, so when we sent out the invitation for this webinar, we asked young people to submit their questions. We also post some questions from WHO to young people. And so we've spent some time going through those questions, and we'd like to pose a couple of the questions that were submitted from around the world to WHO. We will also, once we've gone through these questions, we will also be opening it up to the chat box. And so those of you who are online and want to ask a question, please use the Q&A pod. If you like, please include your name, your country, a little bit about yourself so we get to know about who you are. Or if you have a sensitive question and you want to go anonymous, feel free to do so as well. Again, all the resources that we're discussing today will be disseminated to all of you in an email. And we'll also go out on our website and we'll go out on social media. Okay, so I'm going to pose our first question that we received to James. So we had a question from Simon, who is from the DRC, and Simon works for the Youth Alliance for Reproductive Health. Simon's question is, what advice should we give to couples who live together but can't access family planning services?
So thank you very much, Simon, for that question. And I think it is really the big question for couples during this time. And it is also addressed to the Q&A on contraception that is available on the WHO website. So if you follow that link when it's sent out, you can find an answer to this question and also to others. So if you cannot access your contraceptive method of choice as a couple, and this could be because either it requires a prescription or because it cannot be given to you by the healthcare worker, you cannot access the services. Then there are other methods that you can consider that are available outside the healthcare system, such as condoms, and also fertility awareness-based methods. And the fertility awareness-based methods, they are now quite good support tools that are available online, for example, to support the two-day method. And these, some of them have received approval from regulatory authorities, and this can be used to support your use of fertility awareness-based methods. If the couple has recently had a child within 6 months and are exclusively breastfeeding, they can also use lactation or amenorrhea method. Other methods of contraception can also be recommended for use for self-care. And as I said, this can include pills, oral contraceptive pills, depending on the country, emergency contraceptive pills, and also in some countries, it is possible to do self-injection with DMPA subcutaneous. So these are some of the methods that one can use if they cannot access their contraceptive method of choice. Thank you.
James, I want to ask a follow-up question to that. I think we did also hear from young people, they wanted to know if COVID is sexually transmitted. So, you know, when you have a couple, and they can access family planning services, but should they also be concerned that the virus is transmitted through sexual activity?
So as I said, in WHO, we continue to monitor the evidence, and we have not had any reports of sexual transmission of COVID. There have been a few studies that have tried to see whether one can isolate the virus in the sexual fluids, either in semen or in vaginal fluids. There have been reported cases of detection of the virus in these fluids. But however, that does not mean that can be sexually transmitted. Again, there's been no documented cases of sexual transmission of COVID. However, that said, if one has the COVID infection and then there is intimate contact just through the aerosol route, then it is still possible to have transmission of COVID in relation to any intimate contact, whether this is sexual or not.
Thanks for that clarification. So the second question I'd like to pose is to Chandra. Chandra, we received an anonymous question. This young person said, how can I access services if I live with my parents and they don't know I'm sexually active?
Thank you, Kate. So this is a different situation from the one James the question posed to James by Simon. Here is a young person, a male or a female, having sex with someone in the home or outside the home without their parents knowing. One of the lessons we have learned from AIDS, from 3 decades of AIDS, is simply telling young people that, avoids AIDS kills is not enough. And so what would be useful to do in this situation? I think giving information and support to young people and enabling them to make responsible and well-informed choices. So what does that actually mean? Firstly, for the young person, he or she must be fully aware of the risks of COVID with different forms of sexual activity. As James has just said, while COVID-19 there's no evidence that it is transmitted sexually, the risk of sexual intercourse contributing to COVID infection is high because one is in close contact with the other person. On the other hand, at the other end of the spectrum, masturbation has no risk. If one masturbates on their own, there's no risk. And you can get information in the Q&As on these different levels of risk. So that's the first point. And secondly, once people are aware of the risks, they also need to be aware that this is not only for themselves, but for the other person. Okay, now that you have this information, people are aware of risky practices, less risky practices, and the fact that, after 2 weeks of quarantine, the risk of infection is less. and they decide to have sex, we recommend that they use contraception correctly. So what can you do when you can't get contraception in the context of a lockdown or travel restrictions or service disruption? Government clinics, private clinics, NGOs may be open even in the context of a lockdown. And one may be able to slip away and go to these clinics and get contraceptives. And again, as James mentioned in his introductory comments, many methods, and especially condoms, are available in shops and in grocery stores. They don't need a prescription. Grocery stores are widely open. And as I said in my introductory comments, NGOs like Love Matters in India are trying to find innovative ways to connect young people to service providers. Just want to reinforce one point, that there are a range of methods, and James mentioned the range of methods, but condoms are the only method which can protect one both from an unintended pregnancy and an STI. So that would be my advice to this young person. Be aware of the risks. Be aware that you're not only putting, that risk is not only for you, but for also the other person. But be aware that there are tangible steps that you can take to have sex without risk. Thank you, Kate. Over to you.
And I wanted to ask a follow-up to that, Chandra, and then I'd also like to invite our other colleagues from WHO to respond as well, or any of our other speakers. What are some things that program managers or parents can do to be more supportive of this anonymous young person? What are some things that parents can do? How can we support parents to better understand how to support their own children?
Great. So some quick comments. What could program managers do firstly? Firstly, they can make sure that adolescents are informed about where and how to obtain services. And this can be done through mass media. This can be done through digital media. And so that's one. So at least giving information to young people. And secondly, in health facilities where contraceptive services are provided, to ensure that this is done discreetly and with confidentiality. And discreetness is important. Just because a woman is married doesn't mean that, that she has the ability to make decisions about contraception. And if she's unmarried or he's unmarried, this is particularly a problem if family members are nearby. So discreetly and with confidentiality. And then as program managers clearly can use this opportunity to waive away restrictions if they are there, by age, by marital status and cost, and parental consent. All these restrictions which really have no real basis, because contraceptives are a useful service. They do not cause side effects, as James. They do not cause any serious or even less serious side effects. And the last point is, if possible, to engage community groups and young people to extend the provision in the communities, particularly as the lockdown is reducing. What can parents do? To be realistic, what we can expect parents to do is talk to their sons and daughters about sexuality, about reproduction. And this is a great time to talk about it. This is a great time to talk about puberty, about menstruation, about sexual and reproductive health. And for parents to be aware that, simply telling no does not work. And again, as we have discussed, to provide information and help young people make well-informed choices. Now, this is easier said than done. I'm 61 years old. When I was 16, I went and had sex outside the home without my mother knowing. And I cannot imagine that I could have had a discussion like this with my mother. But times are changing and risks are there, and parents should step up to that risk. Over to you, Kate.
Thanks, Chandra. Anybody else want to weigh in on how we can do a better job of helping parents be more supportive? Anybody else? If not, I'll move on to the next question. Anybody?
Yes, Kate, I would like just
Please, thank you.
Yeah, I'd just like to weigh in on the issue of parents. I think one is, of course, Chandra has highlighted just saying no from parents. That doesn't work. However, it's very important for us to be, and for parents to be aware that what information and how they share this information with the younger people is actually very influential. The parents really hold up a position of great influence on the way the young people access services and what they do to protect themselves. So if parents use the right approaches, then it can be really very influential and can really enhance the young people's ability to access services and to lead productive lives that they will be able to achieve their dreams. Because many times what we are thinking is that for young people, you have the opportunity to have a long-term view. So it's not just about what can happen now, but how will it affect your future? And this is really very, very critical.
Thanks. I agree. Parents are a really important source of information. And we often survey young people, and young people often report that they would love to be getting information from their parents. And yet, often their sources of information are their peers, which are, important sources of information, but oftentimes young people feel that their peers are equally misinformed as they are. So again, parents are a really important source of good information.
Sorry, Kate, I'd like to jump in and just say two other things. And one is that parents have a role in providing information and discussing and communicating and working with adolescents to set limits, but they also have an important role in role modeling. If they disrespect their partner, then it's very hard to communicate different things to their adolescents. And parents, this may be something Avni may pick up in the future, also have an important role to play in being aware of the risks for boys and girls, but especially for girls, and making sure that to be in a high level of alertness to protect them. So, finding a way between protecting them, and at the same time, understanding evolving capacity and giving them autonomy. Over to you.
Hi.
Yes.
Yeah, just maybe to point.
Please, thank you.
Yeah, just since we're on the topic of parenting, there's some very good tips in one of the infographics in relation to two aspects. One is safety online, and there are parenting tips for basically controls, discussion, reminding of online exploitation and the harms of online abuse. So I'm happy to share that link for it's a set of infographics on parenting tips, and then there is specific parenting tips also on stress and anger management, and where the sort of how do you actually prevent that from becoming translating into abuse and physical abuse or verbal abuse. So there's a set of infographics for directly targeting parents on that. And then there's another one on safety more broadly. So I think those three in addition to a more broader range of parenting tips, I think would be quite useful to circulate to this group.
I mean, that's really important and useful information. So now we're going to pose a question to one of our youth leaders, Natasha. Natasha sits on our reference group. And as I said earlier, WHO posed several questions to our youth participants, and Natasha is going to respond to one of those questions. So one of the questions that WHO posed is, how has the sexual and reproductive health of young people like you been affected by the COVID-19 pandemic and by the lockdowns and by the disruptions to health services in many places? So Natasha, I'd love to hear your response.
Thank you so much, Kate, and thank you to FP 2020 for having me. I hope you can hear me. Okay, great. So there are many ways that the COVID pandemic has affected young people. The first thing I will say is that there's a pseudo reduction in demand for family planning services. So it looks like there are not so many people going to the health facilities, but really they're just afraid of being exposed to COVID in these facilities. So people are not going to the healthcare facilities, even though they're still open, because they're afraid that they might get COVID from other patients in the same place. The other issue is that community health workers and all the people that were doing demand creation activities and mobilization are not going out because there's no protective equipment. So the Ministry of Health in Zambia has allowed people to do demand creation activities as long as they are not in crowds, so they can do house-to-house information sharing. But that is difficult because most people who are young they don't have adequate PPE. And if you're going to do that every day, you need more and more protective equipment, which is at the moment seen as something that's not really accessible. So there's little demand creation activities going on. The third thing I want to share is that there's a huge demand on the workforce at the moment. Because of the COVID pandemic, in these healthcare facilities, there's need for increased healthcare providers to do more screening because there's more screening taking place, but also a huge number of the healthcare providers are in quarantine, they are ill, or they are taking part in intense screening, or they have been moved to COVID centers, which has depleted the health workforce. And what has happened subsequently is that the people that were working in youth-friendly spaces are now being taken to the front line, and that is going to affect young people. And it has shown that really there is not much prioritization of services like family planning during the times such as this. Lastly, I want to say that with a country like Zambia, which is landlocked, we are prone to drug shortages and shortages in commodities, because if our neighbors close their borders, then we can't get things in. And so we are seeing some constraints as far as commodity supply is concerned. And this may not only be restricted to Zambia, but it is restricted to other countries as well. But we are feeling it more because we have absolutely no port which connects us to the outside. So that has affected our ability to access products, and there are so many delays in many of the long-term methods and other commodities. I'm not sure if I'm supposed to share what kind of solutions we have been doing, but just to answer the question, those are some of the challenges.
Thank you, Natasha. I think one of the things that happens is in situations like this is, we perceive young people as being very healthy. And so they are not necessarily prioritized in a situation like this because they're quite healthy in comparison to others. And yet what this kind of pandemic reveals is the gaps in the system and the need to really actually focus more attention on young people. We're getting a lot of questions about gender-based violence. And so I'd like to go ahead and pose a question to both Avni and perhaps Mansa would be also able to respond to some of this given her interest and expertise. And the question that's been submitted is, what should we do in the face of increased gender violence among young people, and what are some of the steps that we can take? And this is coming from Brady, who's our youth focal point in the DRC. So Mansa, and I'd start with Avni and then to Mansa.
Okay, yeah. So maybe I'll organize the tips for what young people themselves can do, both as people who might be subjected to violence, but also who might know of family members or relatives or peers, friends, others in their networks who are subjected to gender-based violence. So the first is, obviously, we start with this whole guiding core principle of do no harm and safety as the core. And here there are a couple of things to think about: safety, your own safety, and the safety of the people who you know who might be subjected to violence, and which means simple things. Don't raise the issue of violence when there are other people around, perpetrators around. Be careful about, there are ways to use code words or other ways to communicate if you want help without saying that, because this is also a time when phone lines are monitored as perpetrators are in the same space. A lot of young people don't have access to their own private phones, but to shared phones. So it's just to be very careful about safety at this point. The second is to arrange with trusted adults, in your networks for a safety plan and some mechanism to alert them if there is immediate danger or risk of violence and severe violence especially. The third is really to think about planning for safety if you need to leave the house immediately because the violence has escalated. So, you know, thinking about where you will go, how you will get there, what you need to take with you. The next sort of piece around safety is thinking about how you will keep information about resources. So if you have names and numbers of hotlines or helplines or specialist services for gender-based violence, how you will store that in the, you know, discreetly in the house so that you're not exposing yourself to more danger. So that's the first things around safety. The second is really being very proactive about keeping in touch, regular touch with the social and protective network. So, you know, friends, family, relatives, neighbors, whoever you can communicate on a regular basis, who are trusted, who are supportive, etc. That's your sort of protective network. The next is really to be ready and prepared in terms of getting information about any helplines, child protection services, telephone numbers, text messages, lines that, you know, are available. In many countries, they are now putting these helplines and hotline numbers in grocery stores, in pharmacies, in near ATMs, anywhere you can go, and these numbers are available, or helpline numbers are available. The other thing is, if at all there is any access of routine care, to make sure that if violence is occurring, to raise that with the healthcare provider at any opportunity. And then seeking services. There are hotlines and helplines that are still available. Some of them are mobilizing through online methods of access. So to keep, you know, to seek those specialist services where they are available. For young people who may have been exposed to sexual abuse, to be aware that PEP and EC are time sensitive, and to either, you know, see if these are available in the pharmacies, emergency contraception especially, and also for going to a nearest health facility. Emergency rooms usually should be able to address sexual assault cases on an emergency basis, especially for medication and immediate treatment. And then the other thing is for young people to be aware of what the triggers are for violence, that for themselves to become violent or abusive. Alcohol is one. There are some very practical stress reduction tips of, you know, what we call emotional behavioral regulation. So deep breathing, taking a breath, getting out of the house when you sort of feel angry. So there's some practical tips around that. So those are some of the things for the general public, and then there are very specific asks for government and duty bearers, you know, to make sure that services for violence against women or gender-based violence are included in the essential package of services during COVID, that they are adequately resourced, including hotlines and helplines, that there is some plan to make these accessible through telemedicine or remotely, or, you know, through pharmacies, etc. And then for health managers and facility managers to make sure that the referral directories that they have for these hotlines and helplines and any other social services are updated with the best ways in which they can be reached under lockdown conditions. And finally, for healthcare providers, if they are coming in contact for routine care, even though they are pretty overwhelmed with COVID, if they see or have any reason to suspect anyone that they're being subjected to violence, to proactively ask, and at minimum offer what we call psychological first aid or first line support, which is spelled out in the WHO guidance. So I'll stop here.
Thanks, Avni. Mansa or Victoria, would you like to weigh in as well? Mansa first, and then maybe Victoria.
Yeah, no, so I can talk from a sort of program manager point of view. So for, you know, those managing gender and SRH programming, there is, I'm sure you are constantly in touch with your youth communities. So one way to sort of, one thing to really prioritize during a crisis such as this is to have a list of populations or young people that you know are vulnerable to domestic violence, and to really sort of follow up. because at this point, placing the onus on them to raise an alarm is tough. So you need to be able to follow up and adopt a lot of the covert sort of techniques that Avni was also referencing. So that would mean when you call, you need to ensure that you're not on loudspeaker. A lot of the time, there is monitoring systems within the domestic sphere that insists or demands that young people put their phones on loudspeaker while speaking. Make sure you're not on loudspeaker. When you're asking follow-up questions, devise code words for responses so that the adolescents are responding in those code words. Once the alert has been sounded off by the young person that you're tracking or monitoring, then you need to have had a pre-developed protocol in place where you then take forward coordination from A to Z until the adolescent has been evacuated from the sphere of the space of domestic violence and moved to the safe space. That's a pre-developed protocol that all organizations that work with young, youth communities need to have in place before, on an ongoing basis, so that the crisis time, which specifically exacerbates young people's vulnerability to domestic violence, is really, you're prepared for the same. I think one thing that I would like to touch upon that perhaps we haven't had the opportunity to touch upon yet is really the gender-based violence that comes around, especially for a lot of queer people who aren't out to their families. So as we know, young people occupy different intersections, and for queer young people or trans young people or young people that are non-binary or gender non-conforming, their social circles are their only access to inclusive and sexuality affirming spaces and support systems. So during a lockdown, when ties to these social networks are severed, it becomes really hard for them. There is a common problem such as gender dysphoria that takes place during this particular time. There is a lot of calls that the YP Foundation has undertaken, which has let us know that there are lots of young people suffering from gender dysphoria at this point. Just to clarify, gender dysphoria is a problem or phenomenon when young people are identifying as and not young people, any person who identifies with a certain gender is constantly being denied the opportunity to reclaim that gender identity. And that could be because they are not finding, visual or auditory privacy to be able to perform that gender identity, wear clothes associated with that gender identity, grow their hair in a certain way, adopt a certain name that they're being denied constantly. So all of these sort of issues are, young queer people are suffering from these issues right now. And so one way, one sort of step that civil society organizations as well as duty bearers can take is to enhance young people's access to affirmative spaces through perhaps, virtually or telephonically, if young people could have access to counseling services, to helplines, to SMS services that allow them to vent, to sort of express their anxiety and trauma, and to be able to receive mental health counseling and psychological well-being space for that. That would be helpful. I just want to sort of really leave us with a call for action. During this time, all of us need to be working furiously towards creating enabling adolescent and youth ecosystems. A lot of our programs were heavily sort of dependent on physical contact with adolescents and youth, at least in India, the context that I come from. I know that we were leveraging technology for information dissemination, but primarily our programs run on ground because of challenges with regards to technological penetration, internet access. But we really need to start working heavily with adolescent ecosystems, specifically, parents, teachers, and duty bearers who regulate or gatekeep adolescents' access to their sexual and reproductive health and rights. Now more than ever, we need to start working with them consistently to ensure that they emerge as champions of sexuality, including inclusive and affirming ecosystems for young people. We also need to keep the focus of donor organizations and agencies on adolescents and youth programming, especially around sexual and reproductive health and rights. We know that there is an increasing pressure for donor agencies to shift funding towards more immediate COVID-related concerns, but we need to really ensure that investment is directed at creating evidence-based information and arguments for the sustained work on adolescents and youth sexual and reproductive health and rights, especially as an essential priority during crisis time.
Thanks, Manta. Your passion just radiates. I wanted to pose a question to our WHO colleagues. I think one of the new concepts that's emerging in a number of the countries where we all work is this idea of telemedicine. And can you tell us a little bit more about how telemedicine is working, especially where young people might be concerned about a sexually transmitted infection or want to obtain contraception and they can't go to their facility? So maybe James can start. Can you start with that little talk about telemedicine, James?
Yes, and thank you, Kate, for the question, and also to the participant who asked this question. I think telemedicine has been emerging as a way to practice, particularly to share counseling, to get history and to recommend treatment. It's something which has been emerging in a lot of countries, but has kind of received a boost, just like this kind of interfaces for meeting with the onset of COVID. So specifically in terms of sexual reproductive health, this telemedicine provides a lot of opportunity by which young people and others can obtain information regarding the methods of contraception, regarding various interventions, and in which they can also receive advice. In terms of prescriptions that are provided through telemedicine and people who take medicines that is provided in this way, then it also varies a lot depending on country regulations. And this is very important to take into considerations, and that not in all countries is this allowed, and not in all countries is the kind of legal environment in which this is practiced. And when this is done by practitioners, there's variation in terms of what legal mandate the practitioner takes on. So that varies country by country, but definitely there's a lot of opportunity to expand telemedicine. I know a lot of supplies have also been provided through posts and other means following telemedicine consultations. Again, it's important to consider the country context and in terms of what this means and what can be provided in this way.
Could I, Ian,
Yes,
do you
please,
want to
go ahead.
comment?
Ian or Chandra, would you like to comment?
So while we wait for Ian, I have a comment, Kate. I just read 2 days ago a very interesting paper which we can make available to participants in the Journal of the American Medical Association, the pediatrics section, and it's called Providing Contraception for Young People During a Pandemic is Essential Healthcare. And it provides it's just 2 pages, and it provides simple and practical tips that are being used. And I'd like to just make 3 points from that paper. One is that a safe provision of contraception needs history taking, but it does not really need a physical examination in many cases. And so this history taking and the contraindications can be identified through history taking in a call like this. The second point is a point that James raised, and I think both Mansa and Avni raised in relation to violence. And that is, in the call, how do you assess whether the person is alone, whether the person is with someone, whether they can answer sensitive questions. And so there's some guidance on how to frame the questions so that the person can answer yes or no without going into a lot of details. And then finally, what it says is you can use a variety of methods to following the counseling to give tele-prescriptions or send the prescription directly to a pharmacy where people can pick up the prescription. And one thing that we have not talked about so much, and I think it would be great if James mentioned that, is self-care. Increasingly, what we're talking about is subcutaneous administration of DMPA, of patches. And so increasingly what we have is to link telemedicine also to self-care. Over to you, Kate.
Thanks. Ian, did you want to add anything or?
Not much, but just to really frame this as a tremendous opportunity. In fact, looking forwards, is that if health programs in countries are keen and want to explore these approaches of adapting telemedicine and promoting self-care, now's the time to do it. And I think it really sets the stage for this then becoming embedded as you know, in the future. This will become a normal way of providing services, and it'll provide more options to people. It'll enable greater reach for those people who aren't able to come to facilities or don't want to come to facilities with or without the pandemic. And I think this is an interesting opportunity that's being thrown up by the disruption to the health service. You know, it's something we're trying to actively promote as WHO, and we're trying to encourage and put out there the information about what can be done safely and effectively. Because those are obviously the main concerns we have to make sure. But as James said, you know, right at the beginning, a lot of contraceptives can be made available off prescription, can be easily accessed, can be accessed in ways that don't require physical contact. And so I think for us, it's both looking at the downside of the challenges of delivery, but also the potential. For a new way when we come out of this, of having services available, perhaps, you know, probably more broadly than before.
Yes, disruptions can lead to these innovations for sure. Okay, so I wanted to go back to the questions that we had posed prior to the this session, and I wanted to pose a question to Victoria. Another of the questions that WHO posed is, how could young people contribute to addressing the sexual and reproductive health needs, and especially the contraceptive needs of their peers during the pandemic?
Thank you so much, Kate. I want to start off my response by saying that, first off, there's no straight answer to how all young people can contribute to closing gaps in the SRH and contraceptive needs of their peers and their community members, because there's just such a strong gradient in the ways that the pandemic has affected the sexual and reproductive health of young people and their communities, as well as the various barriers that constrain and inform their personal freedoms from home and the choices that they can make, because they've all been exacerbated by the pandemic, from the lockdowns and disruptions. And a lot of these constraints can range from pre-existing issues that young people face due to their gender, sexual orientation, their race, their age, and the norms maintained in their household. For example, we're really seeing a strong revert back to a lot of patriarchal norms that exist within the household, and having a lot of young girls and adolescents say that it's constraining their own personal freedoms within their homes to even act as advocates. Even then, to the quality of their community's public health system in its resilience to these emergencies. So I really just want to say that, first off, I would argue that how young people can contribute to the pandemic, to addressing their sexual and reproductive health needs of their own as well as their peers, and accessing contraception during the pandemic really needs to be viewed from this intersectional lens that understands their SRH and reproductive autonomy as a part of this broader continuum. For the past 2 months at IYAFP, across our 80-country alliance, and even within the COVID-19 Youth Task Force that we now coordinate and represents over 13 countries and 60+ youth from across the world, we are seeing young people act quickly and with a lot of innovation to the needs of their peers and community members. And we're seeing just how young people can make such a huge difference in curbing the spread of COVID-19 and supporting a full array of comprehensive sexual and reproductive health needs and challenges faced by their peers. So I really want to go into the variety of ways that young people contribute, as we've seen already across the past month, from all the various in-country mobilizations and initiatives that young people have stepped up to the plate to initiate, and see how we can use those examples to really show how much power young people really do have across the world in their voice, in their community-led initiatives, and in their online mobilizations for both their peers, but also their community members and duty bearers that they interact with. So one of the first ways that young people can really make a difference in this space is informing their peers. This is something that we've already touched on quite a bit in this conversation, is the fact that there's a lot of misinformation, and young people can't always access accurate information from guidelines, from facts, from updates from their parents, because they might not have access to the internet or phones, and they can't always talk to their parents about it. So they very much rely on their peers. So we as young people really do serve as educators for one another. And as young people, we're very lucky right now to be adept, agile, and innovative with the many tools and resources that are now coming essential during the pandemic. And when I'm saying those tools and resources, I'm very much referring to digital communication platforms and sources of knowledge translation that are needed to share information for our peers in this time. So luckily for us, we're very much rapidly using these digital tools to close gaps in education, SRH information, and youth-specific COVID-19 guidance, and even provide counseling on issues related to family planning, personal safety and autonomy in the lockdown, and mental health. One of the main things we can do as peer educators in this digital space is contribute to education and information sharing using digital platforms, SMS services, and social media. A really great suggestion that was even brought up from one of the young people that responded to us in preparation for this call was regarding how we as peer educators using youth-led communications such as SMS services and social media, we can raise awareness on hygiene measures alongside SRH preventative measures and what people can do if they need to visit hospital, what are their own self-care and preventive measures that they can take, and perhaps integrating communication methods such as small videos to provide direct guidance that is very youth-friendly and accessible to them, maybe through their smartphones or their laptops. Another way that young people can contribute to closing any gaps around sexual and reproductive health and needs that young people face in terms of sharing information is to really serve as community organizers for young people and be a conduit for sharing information on what services remain accessible in these times. In many ways, young people can become community points of contact for information dissemination and assistance for other youth who are in need. We can use WhatsApp, SMS services, social media such as Twitter to create kind of like ecosystems of information within our communities and share information on the helplines, walk-in shelters, hotlines that people can call in when they need help, and really just be that conduit for community support and access to available services. Young people in this moment really need access to direct advice regarding their sexual and reproductive health, and to know where there are functional health centers offering family planning and sexual and reproductive health care, so they can access contraceptives of their choice and adapt to the situation quickly, especially when they might not otherwise know of these available resources and services because they can no longer access information from their schools or community health centers because they are now in lockdown. So this is a huge area where young people can play a very big role. And we really hope that young people take advantage of all the amazing resources that are available to them and all the digital platforms that they are already so adept at using. We also think that they can, as disinformation communicators, really help in sensitizing their peers as well to the many changes that they're facing, and seeing and helping each other plan for their sexual and reproductive health care and share information around how to manage functional health centers that do exist, and where using, for example, telehealth, they can access contraceptives by phone. And then on this point of information sharing, I want to leave us with how young people can provide and ensure that there's an availability of youth-friendly guidance and peer counseling support. Not only are we educators, but we're also peer counselors, and we also close gaps in the level of guidance. We are very lucky that we have people like the WHO who've done such a diligent job in making sure that there's guidelines readily available for us. One of the issues that we do find, though, is that a lot of the guidance that we have within our communities is not always youth-friendly. So what young people can really do is use their presence on social networks and in other knowledge-sharing platforms such as publications, posters, video conferences, WhatsApp chats. Use these platforms to deconstruct any misinformation that's in the news and deconstruct rumors around sexuality, sexual and reproductive health, and our options during COVID-19, and really share with each other what our personal freedoms are during lockdown, what options we do have for our personal safety, and what options we actually do have around our sexual and reproductive health, to make sure that young people aren't acting in ways that don't make sense due to any kind of rumors that might be spreading myths or misinformation in the news, or misinformation even in their own homes. For example, one of the youth members of the COVID-19 Youth Task Force in Pakistan, they created a mini mobilization within their communities across Pakistan and created digital posters to respond to the rampant misinformation around access to services. And they made all these digital posters, started spreading them all across their various social media platforms within WhatsApp, and then several other youth in different countries took those digital poster templates, revised them and repurposed them for their own context, and then shared them, and really got the ball rolling on this new digital campaign of using posters and drawings and their own messaging to make sure that all the guidance is youth friendly, and really to dispel any rumors or myths that might exist, especially for young people who already face other types of discrimination. As well, a lot of the youth across our task force are starting to host online peer-led sessions to provide a sense of counseling. Something that we've already addressed in this panel is the fact that young people very much need direct guidance and advice, and they might not be getting this from their parents, especially guidance and advice that is safe, confidential, discreet, and helps them address some of the pre-existing areas of discrimination that they already face around their sexuality and gender. So in Kenya, one of our youth members of the COVID-19 Youth Task Force, who are a part of this community-based organization called Generation Guiders, for example, have begun using SMS texting and digital posters to provide direct counseling to adolescent girls and young women with information on where they can access contraception easily, what their options are during lockdown, and to provide direct responses to people looking for someone to talk to around even issues regarding their mental health and general well-being. This is really, really important for youth to feel like they have a safe space where they can go to talk to other people, get information, and even just talk about the daily issues that they may face, so that they don't feel as alone and know that there is information available to them. So we're really happy to see this initiative take place from our youth members in Kenya.
Thanks.
Thank you.
Go ahead. Did you want to say one last thing, Victoria?
My last comment is, I just want to mention is that we all have we have a lot of power as advocates, and there's many ways that we can make a difference as advocates in this space. We can speak to our consultants, we can speak to our healthcare practitioners, and really just share information and use our voices to change the agenda.
Thanks, Victoria. And that was certainly one of the things we saw when the responses were coming in from young people, is they were very, very keen to be well informed so they could in turn inform their peers, because we know young people do rely on their peers for information. Ian, I wanted to pose a question to you from one of our young people. Kawanda Rahim is 24 and lives in Burkina Faso. He loves research. I knew you'd like that part. Football and music. And he wants to know, what is the current and long-term effect of COVID on SRH Specifically with regards to HIV, what are you hearing?
Okay, thanks. And no, I like the football and music.
And the music too.
We've got a lot in common.
Trifecta.
Thanks for the question. And in terms of the current and maybe longer term impacts, yeah, we are concerned that for all of the reasons that we've been hearing over the last hour and a half, that there could be disruptions that may stay in place, and both in terms of health services when they do return to normal. Maybe some of these services won't be fully back to where they were before. Maybe we will be losing some of the many gains that have been had over the last few years. And so, certainly from our side, we're really trying to promote to countries that reproductive health services, sexual reproductive health services, are essential and should be sustained to the highest level possible. And that includes looking at all of the alternatives we've been hearing about in terms of telemedicine and other ways of providing commodities and services that people need. As I also mentioned just now, we're also hopeful that could be an opportunity to not only go back to the normality of service provision previously, but to an expanded version where we do have further options and a different way of looking at services for everyone, including adolescents. And so, I like to be an optimist and see the glass half full even in times like this. And I think, yes, we do need to help, and countries really need to take on board the message that we're putting out, that sexual and reproductive health services are essential and should not be diminished or considered as optional. They are absolutely fundamental to people's health and well-being and survival. But at the same time, let's take this as an opportunity to explore new approaches. In terms of issues around sexually transmitted infections, including HIV, this is an area where, again, it's an important area for people living with HIV. It's critically important to ensure that the treatment services and treatment medications continue to be made available. I know our colleagues in the HIV department have been putting out quite a bit of guidance around this and some suggestions. And this will obviously vary from country to country, and depending on how currently people are accessing their treatment and medications, etc. And so, again, to the extent that that alternative approaches of having multiple prescriptions prescribed, multiple month supplies can be used, that they can be sent by mail or by outreach workers or other ways of using these approaches. Unfortunately, the HIV community has proved incredibly innovative over the years, and I really think this is an opportunity again to push the boundaries on what's been happening previously and going forwards. In terms of prevention, clearly the same behaviors apply, and the same HIV STI prevention means are promoted and should be promoted as much as possible. So from that perspective, there's nothing really much different to be promoted, except that, taking into account the many discussions we've had already about the issues of non-consensual sex, unprotected sex, and particularly access to condoms, whether that's being disrupted in terms of both in terms of production and supplies and distribution, is something to keep an eye on. Self-testing for HIV is something which WHO has promoted for several years now, and the extent to which self-testing can be done virtually, can be done through accessing self-testing kits from pharmacies or elsewhere. These are all options that should be explored and promoted as much as possible. So just, I think using the example of STIs and HIV, I think I would also like to make the point that I said at the beginning, that we are seeing serious disruptions. We are encouraging countries not to deprioritize sexual and reproductive health services. But also, thirdly, we're also really promoting this as an opportunity to grow the number of options available to people so that everyone gets to access the services where they want, when they want, and how they want to. So thank you.
Thanks, Ian. And I was thinking about this earlier, that this is an opportunity for us to push forward on some of the things that have come out of the ECHO trial as well in terms of integrated service. So again, disruption may spur some innovation. Beth, I wanted to ask you a question. One of our participants specifically weighed in. We have Cabre Justin, who is 23 and also from Burkina Faso. And he likes to play Scrabble. And he also volunteers with Billy Now. And Cabre wants to know, what can young people do to help FP 2020 achieve its mission during this period? So what do you
Thanks, Kate. And hello, Cabre, and thank you to everybody. I just wanted to follow up quickly on a point that Ian just made, because before talking to your point, Cabre, right now we're in this initial response, and a lot of us are feeling like we're scrambling, our governments are scrambling, we want to stay safe, we want our families to stay safe. But this is going to be with us for a while. And to the point of innovations and to doing things differently, and I do think it's important to take inspiration, as you mentioned, Ian, from the HIV community, who, when the pandemic first came about in people's lives, they had to be innovative. They had to think differently because people were dying and it was a critical crisis. And it was through that and through that terrible tragedy that norms changed, and not everywhere and not everything or as far as we would want, but services and the way that we think about sexuality and the conversations that we have changed as a result of that. And right now, there's a lot of fear, there's a lot of misinformation, there's a lot of lockdown of people and their ability to move. Those are going to start to change and to open up. And so we have to think about the longer term picture as well of what this pandemic provides in terms of changing how services are provided and how we talk about and reach young people. And so let's think a little bit strategically as well about how we can use this moment together and in our communities to change those norms. Talking about telemedicine, talking about emergency contraception, self-care. The reality is that we're going to have to do this in a lot of ways in our lives for a lot longer than maybe we thought we were going to. And that I believe that minds will start to open up, not everywhere, but in ways that we can make these strategic gains, because services aren't going to be as accessible in some ways. And so let's also play a long game with all of this as well, and try to think about what we're learning together, and to work with those who can help us to take those steps within governments, within services, within policies and programs to really change the dynamic as a result of this pandemic as well. So I know that's not going to be an option everywhere, but it will be an opportunity to form new alliances, to form new partnerships, and to maybe open things up in long-term ways that can have an impact over time. And so, Aubrey, that's how I would get to, Cabre, get to your question about how you can help FP 2020, which is to help us make the case for you with the various partners that we work with. Share the information that you have about the reality of both the operating framework, what's working, what's not, where you see opportunities, and how we can partner with you to make the case as well, so that you have more to build on, because you can link to articles or to information, or we can help to make statements in ways that then you can build on as well. We see FP 2020 as being sort of one of the partners that's a connective tissue, along with IY, along with all the partners here that are on the call. So if you're sharing information or saying, hey, it would be really helpful if you could do X, Y, and Z, we are very open to hearing what would be useful to you so that we can help play that connective role. So please think of us as a partner that can open up conversations, create moments like this where people can come together, and then help us learn along with you about what you need in countries, the kinds of statements, the kind of advocacy that you can use and build on as well. So thanks, Kate.
Thank you, Beth. And we're definitely all in this together, and we need to continue to build those kind of collaborative relationships. So I wanted to go back to our chat box, and I think I'm going to pose this to James, and maybe also Chandra might want to weigh in. We have a question from Fatima Lawal from Nigeria. Fatima is a youth ambassador with the Nigerian Urban Reproductive Health Initiative. And Fatima is pointing out that in many instances, we're seeing community health workers are stepping up in place of nurses who are on the front lines of dealing with the pandemic. Community health workers are becoming really important frontline providers of sexual and reproductive health services. And yet we know that the community health workers have not always been sort of a priority for our work in training providers to be more youth-friendly. So Fatima's question is, what measures are in place, or what measures should we be putting in place to ensure that our community health workers are responsive to the needs of young people and friendly and supportive of their sexual and reproductive health and contraceptive needs? So I think I'll pose that to James first, and then Chandra, if you'd like to weigh in as well.
And it'll be great also to have Natasha's opinion on this. She talked a little bit about that.
And Natasha, thank you. That'd be great, because Natasha's also, she has that field perspective.
Okay, thank you very much, Fatima, for that question. And I think community health workers for many years have been an exploited resource, particularly in the area of contraception. We have not really leveraged the skills and the abilities and the reach of community health workers. And this has work that WHO has been engaged in for the last very many years. And depending on training, community health workers can provide all family planning methods other than permanent methods. And therefore, there are very few limitations in terms of what community health workers can be trained to do. So one of the areas we really need to step up is in training community health workers to provide a broader range of methods. What has become very clear, particularly with COVID, is that services that were being provided by community health workers are more resilient, we would say, to the kind of disruption that we have been seeing. The community health workers are still able to continue providing services even when the health facilities have been closed or the health workers have been pulled to do other things. So it is very important for us to step up the role of community health workers. I think the other area where we find community health workers are important is just acceptability of the services at the community level, and also the ability to reach young people. The young people have a lot of challenges, and although we are increasingly trying to address them in getting services from facilities because of various challenges involved in that, and community health workers can be able to step up in this gap. So I think, as we discussed with telemedicine, this is probably a wake-up call for us to expand the services that can be provided by community health workers, to have these community health workers in place, and also to include them really as part of the healthcare system, because they are an important player who often, when discussions are held about services or about organizations, they are often not included. So Fatima, thanks a lot for that question, and I really agree with you that community health workers are invaluable and are particularly important during this time of the COVID pandemic. So maybe over to you, Chandra.
Thank you, James. And I don't want to repeat what James has said very clearly. I just want to say that, give you two examples. Two countries, over the last 10 years, we in WHO have been documenting countries which have used approaches which have achieved results. And one such country is Ethiopia. Now, Ethiopia had very low levels of contraceptive use in single digits. And one of the important reasons for Ethiopia winning a prize in 2 international conference in family plannings was because of a comprehensive program which included health facilities and health posts and health extension workers. So the answer to your question, Fatima, is there is an African country which has done it, which is a model. And they did it by identifying people from the community, training them over a 2-year period. I don't know whether it's 2 or 3 years, but it was good training, solid training, and they were paid and they were supported. So they became change agents in the community. They provided contraceptives on the spot. They also provided a bridge to health facilities. Now, that's the kind of, if we want people to deliver, and this is Natasha's point earlier, they need equipment, they need support, they need recognition, they need to be rewarded. In many places, this is not done. And then why are we surprised that the work is not very good? The other example is England. England is it's a country which had the highest teenage pregnancy rate in Western Europe. And over a 10-year program between 1990 and 2000, they reduced that the pregnancy rates. And one of the reasons they did that was because they had youth workers who would go out and reach young people in the community. Very different from the Ethiopian health extension workers. Each country will have a different model, but they had youth workers who went out into the community and reached people who were most vulnerable. So there are examples, and we'd be happy to share these case examples with you. Over to you, Kate.
I just want, okay. Well, I want to say that there are, just like Chandra said, there are really good models on community health workers participating in family planning uptake. And from the Zambian perspective, we do have 2 cadres of people that provide family planning. The first one are the community health assistants. These people receive about 6 months of training to do everything within the health sector. And what the government is doing right now is that they're introducing the RMNCH, which is reproductive, maternal, newborn, and child health in-service training for these cadres. And these people are paid.
That's great.
To go out and do community work, and their job description says 80% of their time is spent in communities. So we are looking to investing into this cadre of health workers to improve in the reach for family planning. But also we have the CBDs, who are community-based distributors. These people receive 2 weeks of training, and they provide family planning simple methods like oral contraceptives, and these go around in communities. And what we're doing as an organization also is we want to train young people as CBDs, and the ministry has not objected this, because if everyone else can train for 2 weeks, young people can train for 2 weeks and provide contraception as well. So this is something that we will be scaling up. So I think that we are thinking of it in terms of we're not training other people to provide services or to give family planning, but there are many people that we can work with in many of our countries, because truly the way that we can increase access is getting it closer to people in their homes and in their communities. Yeah, thanks.
Thanks, Natasha. And it's great that you're training young people as CBDs. I also think there's opportunities to be training community health workers around being more respectful and responsive to young people as well. So there's 2 sides to that coin. Okay, so we are coming on towards the end of this webinar. I wanted to ask the last question to Mansa. This was one of the questions that WHO had posed. And so Mansa, you get to take us through to our closing remarks. The last question that WHO posed was, what are young people's priority needs during this time with respect to sexual and reproductive health and rights and with contraception? So can you give us a few thoughts, and then we will go to closing.
feel like some of my answer would really sound like a summary, but I think, I mean, what I've managed to do is sort of put it into a structure, and it really sort of gives us immediate and sort of midterm, long-term measures that we need to be paying attention to. So one thing that has clearly come out is combating misinformation. Like Dr. Chandramouli had pointed out right at the beginning of the call, misinformation and just an absent levels of information on SRHR is not a phenomenon that is exceptional to the time of COVID. It has sort of predated the COVID crisis, and during the COVID crisis, sources of information continue to be diminishing for adolescents and youth because they are heavily dependent on information that they get through channels, social media channels such as WhatsApp and Facebook, and local TV channels, which sometimes may not be carrying medically vetted evidence-based information. This has really come up as a problem across sort of the interviews that the YP Foundation has been conducting across the country, as well as a lot of the feedback that youth advocates have given to us during the preparation for this call. So combating misinformation is something that we really need to sort of step up and lend impetus to. We really need to be focusing on enhancing young people's access to affirmative spaces and mental health counseling. We really need to be enabling adolescent and youth ecosystems that respond, have a smooth way of responding to the anxiety that has really emerged from this crisis around delays in exams, in career placements, leading to sleeplessness, restlessness, suicidal ideation amongst young people, depression around not being able to see peers and lovers, and to be able to sustain friendships and romantic relationships. Because I think Dr. Chandramouli may have mentioned this earlier, that the fear of breakups and the destruction of social networks is impending and really sort of looming large for young people, and it's something that they value so much. It is so important to them to feel a sense of social belonging. So how quickly are we working on enhancing their access to affirmative spaces, as well as how quickly are we working with their ecosystems to be able to respond in a sensitive manner to the same. As a result, we need to ensure that young people also are made to access their visual and auditory privacy, and parents, teachers, and duty bearers are, keeping on top on top of their priority lists the access that young people need to stigmatized services like contraception, like sanitary napkins, like antiretroviral therapy, like hormone replacement therapy for young people undergoing sexually SRS surgeries, sexual reassignment surgeries, and gender affirming surgeries. And we really need to put back on the map young people's access to abortion services. So one kind of specific thing that has really led, become a result of the heightened surveillance systems that young people are experiencing during the lockdown is the absolute sort of curbing of their access to auditory and visual privacy and space, time and space for intimacy and the exploration of intimacy, including masturbation, sort of bringing that back into the conversation. So maybe now is a good time when all of these access is being disrupted to really sort of look at a paradigm shift where we're talking more proactively about pleasure, about sexuality, and in all its diversity in affirmative terms, and asset framing, all of these things as essential to adolescent and youth's well-being in the long run. So yeah, I think that's where I'll...
Thanks. Thank you, Mansa. Those are great remarks. And certainly one of the things we saw coming through in the questions was the mental health, the impact on the mental health of young people because of the loss of social networks or just stress or not understanding what's going on. So looking at young people's needs comprehensively. Before we go to our final sort of closing remarks, I wanted to give our young panelists, Natasha and Victoria, an opportunity to give us a couple of thoughts or, top 2 things that young people should be focusing on or putting their attention to. So we'll start with Natasha and then finish up with Victoria.
Okay, I've been thinking about two things throughout this conversation. And the first one is that as young people, we need to take responsibility because our future is in our hands. We need to be part of the solution and take initiative to protect ourselves from COVID and also from sexually transmitted infections because they will last long after the pandemic. You can't go around and be careless and say, it was because of COVID, because after COVID, some of the implications will be there long after. So there are facilities like pharmacies and places where you could go and access a condom for like $1 and protect yourself. So before you blame the government, try to take responsibility yourself. And also I want to just say that peer educators, which is something we've been doing within our organization, is that even if you're a peer educator or you work with young people, you are a leader everywhere. So even if it's a WhatsApp group for your class, you can share information about contraception and how to protect yourself. Wherever you are, just because we can't do outreach activities doesn't mean we can't reach out to people, even in the platforms which are not really designated for our work. And lastly, I think it's very important for organizations to support youth work during a time such as this because it is clear that young people are important, and even if they're not the most affected by COVID, we are still long-term going to feel the impacts of this on our economies in our countries and things like that. And so we need to think about supporting young people during a time such as this, and protective equipment is a really good place to start, but also thinking about how youth organizations are going to remain to function after this, because this has had really huge economic impact. And yeah, youth organizations face the risk of extinction. So yeah, those are some of my thoughts on this. Thanks.
Victoria.
Great. Thank you so much, Kate. And thank you so much, Natasha, for those very powerful remarks. I'll try to keep myself short because I know we're cutting it close on time. My first point that I want to share is just a reminder, and it echoes a lot of what Natasha just mentioned, is how much power that we have as young people across the world to close existing gaps that have been created by the pandemic now and in the wake of the pandemic over the upcoming year. We have power as advocates, we have power as community members, and we ourselves can make a lot of difference in being educators, not only as peer educators, but in educators to those duty bearers across our communities and across our health systems in shaping how youth-friendly the pandemic response is, and reminding folks that everything from guidelines to counseling to the services that are provided need to not only be youth-friendly, but also mindful of the various layers of issues that young people face around our sexual and reproductive health, and to make sure that our SRH needs never get sidelined by other more immediate or pressing concerns within the pandemic and country level responses. So that's number one. Number two is for all of us on the call, not just youth, but across all generations. We are all the best place to understand what we and our communities need most during this time, and we can all be a part of the solution. And that starts with being compassionate for those around us and being compassionate for ourselves. We can only make a difference if we are soft on ourselves and practice self-care, being mindful in our leadership and compassionate for our daily experiences. We can only do so much, and we are all working within a time of the pandemic. So I really want us to be mindful of those that we work with and soft on ourselves, and to work across all generations to make a difference. And thank you again for including us as youth in this dialogue.
Great to have you. We do have a slide that has some resources. Can somebody put that slide up?
Coming right up.
Okay. And I just want you all to know that we've received over 100 questions in the chat box, and we will do our best to come up with some responses to those questions when we send out our follow-up email. So Chandra, do you want to walk us through these resources real quick?
Yes, thank you. This is very quick. Three sets of resources, and I'm going to start from the bottom of this slide. And that is the this is the link to our department's web page, which hosts all the publications related to COVID and sexual and reproductive health. So you can go in to this website. That's the last one, the third one, COVID-19 and SRH. So that's our department's website. Earlier in the call, Avni mentioned the resources on violence against women, responding to violence against women and girls. All those resources are available there. James mentioned resources on contraception. They are available there. So that's the first one. The second one is a link to WHO's news page. It's a newsroom page. As you can see, www.who.int/newsroom. This contains a set of about 20 question and answers on mental health in adolescents, tobacco use in adolescents, malaria, so not adolescents, COVID and mental health, COVID and malaria, COVID and HIV, and things like that. So there is a Q&A page on adolescents and youth, but there are a number of Q&As on other issues. And the top one is WHO page, which is a WHO emergencies page, which has all our technical resources. For example, we didn't talk about that at all, but about school reopening. There's a just published guidance on, what do schools need to take into account as they reopen? What do workplaces need to take into account as they reopen? You may have had Mike Ryan on the regular press briefings talking about guidance to how countries should open up beyond the lockdown. All those technical resources and messages for the public, including a section on myth busting are there. So please have access to this. And if you have time and you're listening, take an hour to listen to our press briefings, led by Tedros and by Mike Ryan and by Maria van Kerkhove. Fantastic stuff, cutting edge stuff that WHO is leading. Thank you.
Great. Thanks so much, Chandra. So I really want to thank everybody for taking the time out today to spend a couple of hours with our distinguished panel of experts from WHO, as well as our youth colleagues. It's been a really fruitful and really rich discussion. Again, we will be sending out an email with some follow-up information, some links to some resources. There are resources that are out there. Please don't hesitate to call on WHO. Don't hesitate to call on us. We want to help you navigate your way through this pandemic and ensure that you come out of this safe and healthy and protected. So I'd like to ask Ian for his sort of final comments, maybe some words of encouragement, and then Beth to take us to the end. So Ian first and then Beth. And again, thank you so much to everybody. Much appreciated.
Well, thank you, Kate. And this was a great session. I really enjoyed it, and so much for the not only the panelists, but also I've been following the more than 100 questions that have been coming in over the time, and they're great questions. And as I said at the beginning, for us, we're really here to listen. And the 100+ questions we've got now, plus the questions before, give us so much help and very thought-provoking, as well as the encouraging as well. There's a lot of words of encouragement as well there, which suggests we're on the right path in some ways. But I think it's been very reassuring to hear so many different examples, and I'd particularly like to thank Victoria, Natasha, and Manasa for their tremendous inputs, and having collated the inputs from your colleagues and your friends and the constituencies you represent. It's really been very helpful to us, and certainly those of us on the call now and our other colleagues who are not here as a talking head will benefit a lot from all of this. And we'd really like to encourage FP 2020 to continue to sort of mobilize the adolescent and youth community, and to keep us engaged with you through these mechanisms. As Beth said, it will unfortunately be living in the time of COVID for quite some while yet. And so I'm sure there'll be some good chances to repeat this in the future. And I think we'll be more than happy to be part of that if it's going to happen. So thank you to everyone that's organized it. Thank you for the panelists, and thank you again tremendously for all of the participants who've patiently listened and made some great comments and questions. So thanks everyone. Thank you.
Thanks, Ian. I can definitely see in maybe 3 to 4 months' time, as this pandemic unfolds, having a similar conversation like this again, because as we were all saying, this is all unknown, uncharted territory for us. And I think we'll continue to need to share these lessons, especially with our youth constituency. So, and Beth, handing it over to you for our final words of wisdom as we go forward into the rest of our day, or end our day, as it were.
Thanks, Kate. And again, the warmest thanks to all the participants and all the panelists. You know, this FP 2020 is all of our partnership, and we're here to try to do things that are useful to all of you. And so this is a very special invitation to adolescent and youth partners across the world. We want to do things that are helpful to you. So let us know what they are. As Kate said, happy to do this with WHO as long as they're, or as often as they're available and as often as it's useful to you. There are many kinds of conversations that we can use this platform to open up for you. So let us know what you want, what's useful to you, and we're here to try to do those things that are gonna make a difference in your lives. So I just, again, a warm thank you, again, particularly to Mansa and Natasha and Victoria, and to all of the youth participants who shared their questions and concerns. This is going to help guide all of us in our work. So please do consider us partners. And Natasha, your comment about youth-led organizations potentially disappearing is something that's really haunting, I think, to all of us. Youth participation and youth partnership matters, and it's up to us now to step up and make sure that all of you can continue to work in this sector and to be there as the leaders now and the pipeline of global leadership for the decades to come. And so we want to be those kinds of partners to you. So let us know, as you said, what you need, particularly to make sure that resources are available so that you can continue to operate and to lead your lives, to eat, to have housing during a time when we see, you know, potentially economically massive hits sort of coming to all of us coming down the pike. So we're here for you and with you, and just thank you for your partnership. Stay safe, stay healthy, and stay in touch. Thanks, and goodbye.
Thank you, Beth, and to your great FP 2020 team.
Thanks.
Thank you.
Bye, everyone.
Thank you so much, Kate. Thank you, everyone from the WHO and everyone who joined us today. Thank you.
Thank you. Bye-bye.
Thanks. Bye-bye.
Thank you, WHO. May we be part of like more meetings.